Good morning. I'm Cheryl Strathman. I'm chair of the Public Health Committee, and thank you. And I would like to call to order the Public Health Committee meeting on Wednesday, July 19th. This is the 200th day of the year and National Daiquiri Day. But we should all go out and have a daiquiri and celebrate that this is okay, make everybody happy. This is also the 175th anniversary of the Seneca Falls Convention, which was the first women's rights convention in our nation. So that's a good reason to have a daiquiri.
Double daiquiri.
That's right. Yeah. So good morning. Can we have roll call, please?
Juby?
Here.
Silva?
Here.
Silva is here walking in.
Tarver?
Carver's here.
Williams? Young?
Young here.
Sanchez? Strathman?
Strathman here.
Tepe?
Tepe here.
You have a quorum in the room.
Okay. And I have had no requests for remote attendance. Did you? Okay. Okay. I'd like to ask for approval and a second for the minutes from June 21st. Anybody have a motion to approve the minutes?
A motion. Carver seconds.
Okay, that's Young and Tarver. Any discussion on them? Okay, so this morning, roll call, please.
Juby? Silva?
Yes.
Tarver?
Carver, yes.
Young?
Young, yes.
Strathman?
Strathman, yes.
Approved.
Thank you. Now, next we will be moving to public comment. But before we start that, I just want to say that we'd like to welcome all our speakers this morning. And we appreciate you being here and the time you have taken to come here and to share your opinions with us. I would like to remind you that County Code 2-46 states, and if Blair, you'll put that up on the screen for us, that this is what it says: unless waived by a majority vote of the board members present, total public comment time for items listed on the agenda will be limited to no more than 30 minutes at the beginning of the agenda. Individuals who have provided notice of their intent to speak will be allowed 5 minutes. A total public comment time for items not listed on the agenda will be limited to no more than 15 minutes at the end of the agenda. Individuals who have provided notice of their intent to speak will be allowed 3 minutes. And so I understand we have a lot of people here showing up to talk about resolution 23-1007. Can I have a show of hands to see how many of you are, so that we can figure out how we're going to approach this public speaking? Can I see how many people are here to be in favor of that resolution? Can I have a show of hands? Yes, sir. That would be what okay. Okay, thank you. And how many would be in opposition? Okay, I just wanted to make sure we had time for everybody. Now, I also understand that somebody has an appointment and would like to go first on, and that was Mr. Ken Lobel. Is that correct? Yes, an appointment. Is that correct, sir? Okay, if you please come up to the, and let me just tell you before you start that what we will do this morning so that we can have some decorum in the room, when we will be timing you, and this will be the stoplight timer up here. When the end of your time is approaching, you'll get a verbal cue that your time is ending. Then we will tell you that your time is up. And then we'd like you to conclude and sit down. If not, we will be saying that your microphone will be turned off. Then we will turn it off, and then people will be escorted to their seats.
That's what they do when I play in a band and I sing. They shut off my microphone. I'm familiar with the hook.
Are you singing this morning?
I'm not going to sing and I'm not going to tap dance.
Okay. All right. Thank you.
I would like to say thank you for letting me go first. Thank you, everybody here. So don't start the clock yet. Okay. Ready?
Are you ready? Yes.
Ready, go. Okay. If I could, I'm going to ask for board participation and member participation real quickly. I will stay within 5 minutes. If you were asked what shape this represents, could we agree? We would say a rectangle. But if we take it this way, could we say it would be a line? A line. So the point is, I use this when I teach. I teach at Judson University and a couple other universities. And the point is, perspective matters. You could see a rectangle, but you could also see a line. So it's important that we consider that there's other perspectives than the ones that we have ourselves. So I'm speaking because I was inflicted with a blood cancer within months after taking a vaccine. That's the appointment I have to go to today. And I am opposed to Kane County using United Nations and World Health Organization logos and literature for Kane County taxpayer information. I will be brief, concise, and get to my points. So questions you may have: why is the World Health Organization in the crosshairs? If they promote global health, why wouldn't we want to use their materials? And reasons why a foreign entity is being promoted using Kane County tax dollars. Either you are forced to comply by a higher governmental entity, or the use of World Health Organization material was never considered as a potential external outside influence. Or perhaps you agree with what they stand for. I would like to, or you weren't aware of the crimes that the World Health Organization is involved in, including the admission of multiple rapes during times when they were supposed to be helping people, but instead they had, I believe it was over, was it 82 people that were accused of rape and found to be guilty. So they're not an upstanding organization in and of themselves. 2 weeks ago, I was at a place where people were enjoying legally the use of gummies. One person enjoyed the use of gummies and had a great time. It was legal, it was authorized, they could do it. The next person also used gummies, and at 4 a.m. they had to be taken away in an emergency room. Their blood pressure had fallen. The same medications for different people don't have the same results. Asking to remove the World Health Organization logo and material is not saying that vaccines are bad. It's not saying that we shouldn't look at our health care. It's saying that we don't want to have an organization that is a subsidiary to the United Nations, which competes with the United States, providing healthcare recommendations. And we don't want Kane County being the ones distributing healthcare recommendations that are general in nature and apply to everybody. When I just witnessed 2 weeks ago, one person taking the same product as the other, one nearly died, and the other person had a different reaction. I got blood cancer that inflicts less than 4% of the population. Somebody else didn't. The vaccines can work for some, not for everybody. And it shouldn't be something that's mandated or forced.
That was
So-
for you, sir. Sorry about that.
No problem. So what I would like to get to my point is that some of this could be handled very easily by just simply Kane County, number one, providing fair and balanced representation. So when you tell people to mask up or vaccine, also include that there could be adverse reactions. Number two, Kane County Board is not a licensed medical professional. So recommend to people that they consult with a licensed medical professional. It's required to do that in the securities industry. It's required in other industries. And just walking across the room and getting the Veterans Administration literature, I noticed that, and this one is very appropriate because it's talking about the impact of Agent Orange, something that was denied by the government as an attack, but later was disclosed that was an undercover operation or whatever. And there are many viewpoints on what COVID actually was. But one thing that's interesting here is at the end of this brochure, it does say, if you are concerned about bile duct cancer, please talk to your healthcare professional. So my interest today is to have Kane County not serve as endorsing a United Nations subsidiary, the World Health Organization. It's okay to use their information. I'm not condemning World Health Organization, but Kane County, with our tax
15
dollars,
seconds.
should promote the interests of Kane County residents and shouldn't be in the business of practicing medicine, shouldn't be in the business of making healthcare recommendations, and should put that in the conversations between a patient and a healthcare provider. So thank you. I hope that you will
Thank you.
deny, whatever that motion is. Don't cut me off.
Roxanne Shulka.
Before the clock starts, could I take a moment to offer an apology to Mr. Isaacson?
Okay.
We're good? Okay. At the last meeting, my comments were based on what I thought you heard, what I thought I heard you say. It was saying that the funding for that resolution came from EcoHealth Alliance. You mentioned Something Health Alliance. I heard EcoHealth Alliance. You did not say that. You clarified the funding's coming from the CDC. So my apologies for misquoting you.
Problem.
Okay. I'm on topic, so could you restart the clock?
Yes, we're doing that now.
Thank you. Okay, I had intended on speaking about how that resolution though is unconstitutional, but when I saw on today's agenda that you're considering removing references to the UN and the WHO, I wanted to take this time to instead encourage you to pass this. Why does that matter? Association is important, even more so when you make it public in an official way, such as on a website or in print, because it sends a message that you stand with that person or organization, that you share similar values and a vision. The WHO does not share our vision of national sovereignty or value individual rights, which our Constitution protects. So when you took your oath of office, you promised to support and defend the Constitution, not the CDC, not the UN or the WHO, but the Constitution. And when you visit the website of these various organizations, you will see that they are all connected. For instance, EcoHealth Alliance has the CDC, NIH, and pharmaceutical companies, among others, listed as partners. The CDC also partners with the Bill and Melinda Gates Foundation, Google, Meta, PayPal, and many others. You get the point. Your associates paint a picture of who you are and what you stand for. And that's why the removal of all non-US references is important, because it implies a de facto endorsement. I will focus my comments today, because of time limitations, on the World Health Organization. The United States is unique in that our Constitution was written for a free society and recognizes our natural rights. It doesn't give us our rights, but it protects them. In fact, many oaths of office for elected officials include the promise to protect people from all enemies, both foreign and domestic. That includes our own government, by the way, in the form of bureaucratic overreach, but also foreign entities like the World Health Organization. In May of this year, there was a meeting in Geneva, Switzerland of the WHO. They proposed a treaty in which nations from around the world would cede authority to them to manage and control any pandemic or emergency. If passed, the WHO would no longer be an advisory board, but become a legally binding global authority. That means the globalists at WHO would have complete control over US water, food, medicine, treatment, travel, social interactions, and many more. Is that the kind of association that Kane County wants? I think not. That's not who we are. We are an exceptional country, blessed with a legacy of liberty and freedoms. This written document, it's a pocket constitution, is what protects us from our enemies, both foreign and domestic. It protects us from unreasonable searches and seizures. It protects our right to assemble, to speak our opinions, to seek redress from authorities. It protects our rights to property and the ability to defend ourselves. We are still a free people, at least on paper, but the WHO Treaty would take that away. We are Americans with guaranteed freedoms, not global citizens with allegiance to elitists. Our founding fathers left us with this warning as expressed by John Adams. He said, if people abandoned the freedom gained by the adoption of the Constitution, it would be treason against the hopes of the world. Association with the WHO sends the wrong message. I urge you to pass Resolution 23-1007. Thank you.
Would you like to go next?
No, I actually signed up online because I didn't know the process.
Oh,
So
okay.
it was a test.
Okay.
Sorry.
Did we pass?
Thanks.
Okay, yes. Okay, the next person I have online or on agenda to speak is Brian Anderson. Is Mr. Anderson here? Is he online? Okay. The next person on agenda that I have is Terry Bauer.
Good morning, everybody. My question is whether the WHO handled the pandemic successfully and deserves to be in charge of our health sovereignty. And so, are we ready?
Yes, go right ahead.
Okay. Below, I'm going to start with a quote from Dr. Geert Vanden Bossche, a world-renowned expert on virology. Considering the WHO's aspiration to strengthen and expand its role in pandemic preparedness and response, one might reasonably assume that this organization possesses the scientific knowledge and skills necessary to protect the world from emerging pathogens that spread globally. Their incompetence in handling infectious diseases extends not only to the emerging pathogens like SARS-CoV-2 and pandemic threats like the avian flu. End of quote. If the WHO would have handled the pandemic correctly, there would have been a deliberate decision not to cause fear and panic. Fear and panic can only lead to one thing: bad decision making. Information would have been delivered in such a way to keep people calm and give people peace of mind. Instead, it seemed that there was a daily global initiative to spread fear, and cases of COVID-19 were listed. Not deaths, but cases were listed in order to ramp up the fear. What was the actual death rate of those that died from COVID? Most people do not know the answer to this, but it was almost exactly the same as the regular seasonal flu. Secondly, we would have seen a panel of experts that would have had robust discussion about the best practices and the most effective ways to monitor the disease and ways to contain it. Instead, there was no discussion by doctors that were successful in treating COVID, like Dr. Zelenko. And those doctors that were successful were censored and their licenses were revoked, which prevented them from sharing their wisdom and expertise and from making a living. The WHO, as it is today, is almost entirely influenced by this CCP, the Chinese Communist Party. Do we really want the CCP to control our health sovereignty? If WHO would have handled the pandemic correctly, we would have been told there was no need to get vaccinated once you recovered from COVID. For hundreds of years, doctors and people, regular people like me, have known that once you recover from a virus, you are then immune to that virus and almost also to most variants. But during the pandemic, we were told that even if you recovered from COVID, you need to get vaccinated. Those who had COVID were sent home empty-handed and told to take Tylenol and go to your ER if your lips turn blue. Once in the ER, the protocol was the expensive, unreasonably expensive remdesivir, which was nicknamed by nurses, "Run, death is near," and caused a high percentage of kidney failure. Again, I will quote from Dr. Vanden Bossche. Given these glaring examples of incompetence, granting even more authority to the WHO would only lead to further global health disasters These initiatives are completely disconnected from scientific considerations and focus on controlling the global health landscape and the global health narrative rather than controlling the virus. It is not only necessary for national delegates to withdraw from the World Health Organization, but also for countries to halt the massive flow of funding into a dysfunctional global health organization like the WHO. This has now become a genuine health emergency of international concern. End of quote. I would agree that we want to get out of the WHO. We want to defund it, and we do not want the WHO in charge of our sovereignty. The WHO is planning on going from an advisory committee to a regulatory committee, and they will be in charge of everything and even possible pandemics. We don't want this kind of an organization to be telling us that we absolutely have to be vaccinated.
You have 15 seconds.
Thank you. Thank you for your time.
Thank you. Okay, the next person we have is Mary Kay Sharp-Kohler.
I realize that I'm off topic, so I have prepared a 3-minute presentation.
Excuse me, if you are off agenda, we do that at the end of the meeting. So I'll ask you to wait till the end of the meeting.
Okay, sorry.
Thank you. Thank you. So then next I have Lori Powell on agenda. Good morning.
Good morning. Yes, I am here about the resolution, and I have already emailed everybody on the committee and all the Kane County board members. And I've provided links to show that when you go to kanehealth.com, when we were in the pandemic, there were lots of references to the WHO. A lot of those are gone now, but there are still links, and I show the steps in my email. That you go to the Kane County Health Resources page, and then at the resource page, there's other links. And then on that links page, there's one called publichealth.org, and that takes you directly to the World Health Organization's Global Vaccine and Immunization Research Forum. This particular link no longer has that information, but now it provides you a link to the World Health Organization's homepage. Also in my email, I provided 3 articles explaining the agenda of the World Health Organization, which the previous speakers have also highlighted. So here's a short excerpt from one of those articles. So the World Health Organization is preparing amendments to the 2005 International Health Regulations, which, quote, provide an overarching legal framework that defines countries' rights and obligations in handling public health events and emergencies that would have the potential to cross borders. This legally binding international agreement would give the WHO unprecedented power over national level governments and override national sovereignty. The proposed amendments will also transfer the management of every state's public health response during anything the WHO deems a public health emergency of international concern. If adopted, the amendments would surrender future U.S. and global public health emergency authority to the WHO Director General. So I encourage you all to do more research to learn about the WHO and this treaty, and also learn more about HR 79. It's the WHO Withdrawal Act, and I have provided a link to that bill so you can learn more about it. Thank you.
Thank you. I believe that is everybody who is speaking on agenda. Okay, thank you. That concludes our public speaking on agenda. Yes, did you sign up? Oh, okay. All right, if you'd like to speak on agenda, you can be our last speaker on agenda. And give us your name so we have it on the record.
Yes, Jean Meyer, RNMS. On July 5th of this year, and thank you. On July 5th of this year, the prestigious medical journal, The Lancet Preprints, published a paper titled A Systemic Review of Autopsy Findings in Death After COVID-19 Vaccine. The study was approved by the University of Michigan School of Public Health
and used a standard scientific evaluation methodology. The paper was written by one of the world's top cardiologists, Dr. Peter McCullough, Yale epidemiologist, Dr. Harvey Risch, top pathologist, Dr. Roger Hodkinson, and others. Using 44 studies/papers that contained 325 autopsy cases, 3 physicians independently reviewed all deaths to decide if the COVID-19 vaccine was the direct cause or significant contribution to the death, a total of 240 deaths. 73.9% were found to be caused by the COVID-19 vaccine. The mean time from vaccination until death was 14.3 days. The interpretation given in the paper is that the consistency, and note that word, consistency, seen among cases in this review with known COVID-19 vaccine adverse events, their mechanisms and related excess death, coupled with autopsy confirmation, suggest there is a high likelihood of a causal link between COVID-19 vaccines and death in most cases. Further, urgent investigation is required for the purpose of clarifying our findings. Dr. Claire Craig, pathologist and co-chair of the Heart Pandemic Advisory Group, says the approach taken in the study is sound. While we can look at overall mortality rates in a country, this is imperfect. Now get this point, as we would expect a deficit of deaths following a period of excess deaths. Instead, we're seeing excess deaths. The alternative approach to auditing such deaths through autopsy is sound. Within 24 hours, The Lancet removed the paper stating, this preprint has been removed by preprints with The Lancet because the study's conclusions are not supported by the study methodology. Before the takedown, there were hundreds of reviews per minute, and the takedown gave this paper notoriety. The original study abstract can be found in the Internet Archive and the full paper elsewhere, and I'd be glad to email it to you. There is an agenda worldwide that requires only one narrative. Not only is this not scientific, it is communistic. When a government mandates experimental substances to be injected into one's body in order to keep their home and feed their families, and recommends it to be injected into babies and children, despite the fact that around 99.999% of children recover from the virus, while far more are injured, and when the government censors any material that is not consistent with their global agenda, in which the WHO and the UN are trying to enforce by taking over the US sovereignty to make our own decisions. This type of activity is not consistent with a sovereign constitutional republic. Please exercise local control and kick international organizations out of the public health policy. Oppose communism. Let us keep this republic and freedom for our young people. History repeats itself if we don't bother to know it. Our country, with its freedoms and its bounty for all people who are willing to work hard with any skin color or culture, has been an anomaly in history or in the present. And I praise our Creator God for this. I love my country. Thank you so much.
Concludes our public comment on agenda. We'll address the off agenda items at the end of the agenda. That's a lot of words of agenda right there. So, okay. Now we have the next item is a finance and budget, and the reports are attached. Are there any questions? Okay. Then next thing, Mr. Brett Youngstead with Animal
Morning,
Control.
everyone. All my reports are on file. The only thing I have this month is to remind you that August 5th from 10 a.m. to 1 p.m. is our next vaccine clinic. Anybody that wants it, please tell them to come out. Otherwise, if you need the remainder of the dates, I can get you flyers if you need. Or kanecountypets.com will get you to our website and everything's posted on there. Anybody needs anything, please let me know.
Any questions? It's a great flyer. Oh. Okay, thank you. Now we'll move on to the next item with Executive Director Michael Isaacson, and current health updates. Good morning, Michael.
Good morning, and nice to see everybody today. While we're pulling up the presentation, I just want to share a couple of exciting things that are going on around the health department in terms of outreach to the community. So we did just have a very successful outing at the Kane County Fair. One thing that we've talked quite a bit about in this committee is just how many overdoses we're seeing, and in particular, how much fentanyl is in our community as it is across our nation. One thing that we can do is get naloxone or brand name Narcan into as many people's hands as we can. So at the fair, I'm very thankful that between our staff and the wonderful residents of Kane County who volunteered to be part of our Medical Reserve Corps, we distributed over 768 doses of Narcan at the fair. So that's to people who maybe they have somebody in their family that they have concern about. Maybe it's somebody who has a friend that they have a concern about, so they want to be prepared. And again, this is not in support of drug use, but this is so that we can keep people alive. So this is a life-saving medication. It's safe to administer, and keeping people alive is something that gives people the opportunity that hopefully then they can end up in recovery, and so that they can live the best life that they can. So I know several people were at the fair. I don't know if anybody has any comments, or, and I don't know, Madam Chair, did you want to say anything about the fair? I know you talked to her.
Yes,
some
I was
residents.
just commenting that I took the picture.
Oh, you took the photo
Had
credit then.
pictures
Yes.
when I was there.
Very good.
It was so.
Microphone, please,
Oh,
Madam Chair.
It's on. Is that better? There we go. I'm
Gosh,
not
thank you.
closer. It was very well attended. That booth, matter of fact, it was probably the most popular booth when I went to the fair 2 times, and I obviously stopped by and just to observe. There was one gentleman, a father, who was talking to one of the staff members who said that his daughter was having issues and he was taking the Narcan, and how grateful he was to have it and to explain how to use it. And I was truly touched by that, because of the care of the dad. That's pretty brave for a father to do that and to recognize that his daughter, who obviously he loves, has some issues, and he's ready to help her out if so needed. So that really touched my heart greatly. Yeah. So, but then the second day I went, it was swamped. There were so many people at that booth that I applaud this. This was very well done. Thank you.
Great, excellent. And again, I'm very thankful. Our staff have been doing a wonderful job with this, and through COVID and now even as we're working on other health issues, the volunteers in the community who participate in our Medical Reserve Corps are just fantastic. So really appreciate it.
I have a question, Mr. Isaacson. What is the delivery system? Is it injection?
We distribute the nasal spray.
Nasal spray? Oh, okay.
So there is an injectable version, but we found, and we've had our program for almost 10 years now. We started out by distributing to law enforcement, and now we're working, as you can see, directly with the community. But we found avoiding the needles people are more comfortable with. So the nasal spray is a very easy way to administer the product. And as Madam Chair mentioned, people, if there's somebody in your life who may be struggling with substances, again, this is, people are sometimes uneasy with harm reduction strategies or with things like this, but this may keep someone's child alive. This may keep that loved one alive so that we can get them to the point of recovery. And unfortunately, and I know even on this board, we have friends and family members that we've lost to drugs. And certainly in our work around the community, there's way too many people that I talk to who've lost a loved one to an overdose. And this is just a very effective way to at least intervene and keep people alive. So it's very, very important. And there's more to come on the naloxone that I'll be talking about next month. Another thing that we're transitioning after COVID with our emergency planning folks, I want to credit Katie Griffith, who is our supervisor of our emergency planning program. We've been working very closely with the sheriff's office and have now built up a very robust training program for Kane County. Whereas you can see on this, and this is just a generic flyer, but we provide not only CPR training, we'll provide training on Narcan. I should mention, if you go to our YouTube page, you can also see a video on how to administer Narcan, which is quite well done by staff. Stop the bleed training for if somebody is injured. Unfortunately, in the world we live in, as we look at shootings and things like that, this is training that's done in a lot of schools and workplaces. We have people who can do that training as well as first aid. So this is something that over the last year we've really built up, and again, partnering with the sheriff's office and local hospitals, we have a very robust program where we can provide this training free of charge. So if people are interested, and I think this, I don't know if this link or if the QR code is live now. They said, well, I don't know if you should share it in the morning. I said, well, hopefully you'll get it live by the time I share it. So hopefully by the time you put your phone up to it and scan it, it'll be live so you can get more information and put in a request. But we're happy to come to workplaces. We're happy to have courses where people come to us. Just like with the naloxone, we want as many people trained in these different things as possible. So just an exciting positive thing that's going on in the community. Any questions about any of this?
Yes, Ms. Juby?
So I have a question. So we're being trained next Monday by Nikki.
We're all one, yes.
So the health department and the sheriff's department now do all the training?
Right, and our volunteers, yes.
Oh, okay. And you, okay.
So yeah, so we've put together one big program for the county.
Okay, and does that, so who do they report to then? Do they report to you or do they report to the sheriff's office then? If you guys are.
Yeah, it depends. I mean, the staff would
It's-
report to whoever.
Oh,
right?
okay. So you keep individual staff, but you're just working together?
Yes, exactly.
Thank you.
Exactly.
Look
And
forward to
again,
my
there may be-
training.
Yeah, we're
Yeah.
excited to be hosting them for the board. Yeah, so there may be volunteers, there may be hospital staff we bring in, but it's one cohesive county program now.
Okay, cool. Thank you.
And the link does work, so thank you.
Ms. Gums?
Thank you. I'm, Mr. Isaacson, will you also be doing the Narcan at our training on Monday? Or
I don't
can
know.
we?
We can probably add it on. I don't know if they were already planning on it, but the Narcan training is quick and easy, so
Yeah,
we can definitely
quick and
add
easy.
it.
No, I would take a couple of those too. Thank you.
Excellent. And one thing I didn't mention with the Narcan, but it goes with the training. Right now, there's federal money for Narcan. So the state of Illinois provides the Narcan to us for free. So I know when I talk to the media about how we're distributing naloxone, there's not an additional cost to Kane County taxpayers for this. So again, we want to get as much naloxone or Narcan out into the community as we can. It's already been paid for with tax dollars at the federal level, passed down through the state, and the state's deciding to invest more money in it to make it available to people. So that's where it comes from. If you see us in our booth handing out naloxone, we're able to order it free from the state.
Any other questions?
All right, I just wanted to say a quick word about our community health assessment process. So we've talked about this in the past. Again, this is something we do every 3 years. On this slide, you can see the funding partners who participate. You just voted on a resolution at the full county board for us to move forward with this. So we're working with a vendor called Metopio. We're very excited about this. This is a way for us to really dig in and get more health information. So we had a meeting with them yesterday, and we'll be looking for more input from you over the next month or so as we really dig into what's happening in our community. So as I said, this is every 3 years. We do a comprehensive community health assessment. Hospitals are required to do it. Not-for-profit hospitals are required to do it by the IRS every 3 years. And then you can see we also have the Mental Health Alliance, the Inc. board, formerly the 708 Inc. board in Southern Kane County, who's also a funding partner in this. This includes surveys of residents. It includes focus groups. It includes an analysis of the existing data. So the secondary data that's already out there, different surveys that have already been done at the state or the county level. But where we'd really like your input is making sure that we're reaching people so that we can get all voices involved in this. And then if there's other health issues that you're interested in, We want to make sure that we're asking the right questions so that we get in, that we're reaching all kinds of people, and that we're focusing on a broad enough amount of information that we can make the best decision. So the community health assessment is one step that leads us then to a prioritization process where we choose what the most important health issues are for us to be addressing. So this is a plan that comes to the board. It's a community plan. Each hospital uses the information, and the Mental Health Alliance uses the information to form their own plans. Again, just like with the CPR training, we do it together so we can have better alignment with our efforts. So this is really an exciting process. I just wanted to just mention it today as we're getting ready to kick off, just so you know, we'll be reaching out.
And how can we help you with that?
Well, really, we'll be digging in, and if there's an opportunity for interviews, we want to hear from each board member. What are you seeing in your district? What's important to you? What are the health issues that are really important to people in your community? As we're setting up focus groups and as we're pushing out surveys, we want to make sure, as I mentioned, that we reach people. So as the elected official for that district, if you can help us with that, that would be really valuable. So we'll be giving concrete links and concrete questions here very soon.
Great. Okay, thank you. Okay,
I have a
yes, Mr. Young?
David Young. I wanted to ask Mr. Isaacson about this. All of the, the fires coming in from Canada. There was a couple of weeks ago, they declared Chicago as the worst, air quality in the world at that point. I remember I was mowing my lawn, and I came in, and I tell you, for like 12 hours, I was having a hard time breathing. So is that something that the health department would advise on or against, or because the air quality is important, but is that something that you guys would be involved with?
Yeah, no, that's a great question. So certainly over the last couple of months with the wildfires in Canada, we have pushed out information through the county and through the health department to let people know about air quality on different days. We don't technically have jurisdiction over air quality, so we work closely with the Illinois Environmental Protection Agency for that in terms of being able to make interventions, which typically would be more industry focused or limiting burning, things like that. But on the education side of things, that's where our most important role is there.
So would you send out some kind of would you post something on your website, or is that what you would do? Or
we typically have used social media for that.
Oh, okay.
Yeah.
Okay.
But we're open if there's other avenues that we can use.
Yeah. I know you have a blog. I'm sorry.
I'm interrupting you. Sorry.
You have do you have a blog? Maybe next time, I think you have a scrolling blog. Just put something out there so that if people go to that, there could be something about that. But I was thinking about that. Thanks.
And I think with technology now, we can automate, so we can get those warnings automatically on our pages. So that's an excellent idea. Thank you.
I think Madam Chair will allow me to go next. So actually, that's a great question, Commissioner Young. And the thought is maybe we could dig in a little bit regarding that automation that of which you spoke, perhaps text messages for anybody that signs in, that opts in, something where we can blast information that's coming from, I know we're not the authority on the air quality, but if that's already been designated by the powers that be, then we can put that out. So as opposed to it being, we can be a little more proactive as opposed to somebody having to come into the social media or that, because there's lots of folks that don't have the time for social media.
Excellent.
So
yeah, we'll definitely
maybe
look into
text
that.
messages or something is something that we can explore in the future regarding this.
Good ideas. Yes, Madam Chair.
I think both of these ideas are very effective and positive. But I would suggest, Michael, that you work with Roger now, because there is a opt-in right now for emergency, and that would be an emergency alert, but perhaps it can be modified for these kinds of issues, because I was obviously notified on our phones that when you check up the weather, it said, be careful, we have air quality alerts. So that's how I knew about it. And yes, I had the same effect. It was, air pollution is quite severe when the smoke comes in. But I would suggest that you talk to Roger and maybe you could coordinate that. And it really is an opt-in. So our residents are not mandated. It's, if you'd like to get it, you just
Right.
opt in.
No, that's excellent. All three, very good ideas. So I'll follow up on that. Excellent.
They're very good ideas. Thank you. Okay, is that all of your report
No,
today?
I'll transition. I just had a quick comment and I'm keeping it brief today because I knew we had a pretty busy agenda.
Okay,
I just want to make a couple comments about the behavioral health system here in Kane County and what we're looking at as we look at improvements. And again, I just want to kind of plant a seed for future conversations that we're having. So we've talked a lot about the scope of behavioral health issues, including mental health. And, as we see suicides go up, we see fatal overdoses go up. Certainly the pandemic has exacerbated those issues. But there's a lot of other things, I'm always saying that especially with young people, I think our phones and things like that, even though it's a great way to get information to us, also young people and social media, I think is quite dangerous. As a matter of fact, many of our school districts are in a lawsuit against social media companies right now because of the impact. So that's something we're going to watch. But some principles I just wanted to lay out. And then again, just like with the community health assessment, this is something we're going to want ongoing participation. As I've mentioned, I'm very thankful. I know there's a lot of people on this board who are great advocates for mental health. But what are things that we're going to look at? So we need to look at urgent needs, right? What's happening right now? What's most important? That's critical that we examine that. A risk there also is if we look at the urgent needs and we don't look at what our longer term plan could be, we may be too short-sighted, especially if the way our agency operates, where we're mostly grant funded. Short-term grants can meet an immediate need, but they don't help us really build to the future. So looking at what's going on in the state and federal landscape. And one example here is what's happening in terms of what services are reimbursable by Medicaid. So we already have a payment system that's set up with the federal government and the state government, where there may be additional things that the county could get involved in to better serve our community. There may be ways that we can better support our community partners who are already providing services. One thing we're talking about right now that's a big issue is respite care. So somebody who may be providing a lot of care for someone who may be struggling, and the services to be able to give that person a little break, a little time off, are really challenging to find in our community. There's ways that we can continue, and we have a very robust partnership with parents in our community where we work together, we provide training, we increase their capacity to be able to engage in the system. And there's actually services that are billable that we could look at where we could train parents and we could formalize that where they could help with respite care and we could actually be compensated for that. So it may be able to be something that pays for itself, but that we have to keep an eye on what's happening at the state and federal level. Upstream issues, and this is something that for us to be effective, we need to do, and it's also something that can be pretty daunting. So as we look right now, we know housing is a major issue, not only across the country, but here in Kane County, that it's very hard for families to find affordable housing. There's not a lot of rental property that's available. The cost of rental property with statistics that the county's provided is far beyond what many of our families make. So that is a major exacerbating factor when it comes to mental health and substance use. So we have to keep that in mind. However, that's a big issue that we can tease out, bless you, but it's also something that we need to incorporate into our plans. And trauma is something, especially over the last decade, that more and more attention has been given to, where we can see, and this research isn't brand new, but there's more attention that's come to it, where especially young people, when they experience traumas, that has a huge impact on what's going to happen to them in the future. And it's not just dangerous decisions people could make. So we talk about substance use, we talk about suicide, we talk about these things. But as I've mentioned before, we can also draw a pretty good line where people who experience trauma are more likely to have heart disease. They're more likely to have diabetes. So there's physiological things as well as psychological decision-making. That needs to be part of our longer range plan for Kane County and what we're doing. So now we have issues where we have, say, a 10-year-old who needs to get into services. That's right now. And there's funding we can provide to help with that. But we really, the purpose of my comments today, we really need to be looking to the future to say, okay, where should Kane County be in this? What's most important for us? How do we evaluate this? That's very difficult with mental health because of the complexities of all the things involved, but it has to be core to whatever we're doing. We don't want to just throw money at a problem. We want to be putting money into things that's an investment that we can actually see. And actually, Commissioner Juby, we had a conversation the other day, and she made a comment that I love the quote, you know, everything that matters can't be measured, which is absolutely true. And we need to figure out, well, what can we measure, right? So there are things that we're not going to be able to measure that are still critical that we need to be able to do, but we need to build in a good evaluation plan to everything. And then sustainability has been woven into all my comments with this. We have immediate needs. We can put money into something right now that'll help today, but whatever your favorite analogy is, you know, give somebody a fish or teach them to fish. We want to be looking long-term as much as possible. So potential roles for the health department in the future, we already assess and plan. We already act as a convener and a catalyst. I've spoken just one nice concrete example. We have a grant where we're working. It's a 1 year, $300,000 grant, which is not a ton of money, you know, for a county our size. We're working with the hospitals to get peers embedded in the hospitals. So that if somebody comes in with a substance use disorder, we can increase the likelihood that they're going to connect with services, because talking to a peer is a proven way to increase the likelihood that somebody's going to seek those services. So with that $300,000 grant, this is private money. It's not King County taxpayer money. We've convened people, and we're making tremendous progress with all 5 of our hospitals to make changes. So we can continue doing that type of thing. We serve as a funder in many cases. So we work on getting grants, and then we provide funding to our community agencies to make sure that they have what they need. We can provide funding to fill in gaps where they may not be able to meet the needs right now. Certain populations may be harder to reach. We've talked that there's tremendous opportunity to increase our partnerships with the courts and things like that. So there's a lot of opportunity here. And then direct service provider, we provide naloxone, but we don't provide other mental health or behavioral health services. That may be something that we want to get into. So I just wanted to kind of lay this. This is a question I get from board members as we talk about the future of behavioral health in this community. And we really want to aim high. And I know with Madam Chair, we've talked about this over the past couple of years. We want to be able to transform the behavioral health system. We don't want to do, even though there's needs today, we don't want to just address today's need. We really want to build a system that's going to help us in the future. So again, this is just one slide today to kind of tease some things up. And then there's going to continue to be much more dialogue. So.
You knew I was going to say something. I didn't even raise my hand yet. I don't think there's so many things that you said that I could
It's
say
Dr.
something
Silva
to.
speaking.
I'm sorry, but that's such a wonderful, that right there, what you said is golden. And I think that's the $1 million question, because in my mind, I see the cycle. Commissioner Tarver, I know you know this. You see the cycle and what's going on. And so one issue is associated with a lot of issues. There's the breakdown of the home, there's divorce, there's substance abuse, and now this 10-year-old financial stressors. And now this 10-year-old is also having personal life issues. They're trying to figure themselves out, and then they grow without that intervention. So that is so loaded, what you just said, and so on point. The other thing that I would like to say is you talked about private money. And I agree. I happen to agree. Not all money is good money. I do believe some money is tainted. However, we do have to take into consideration that we are trying to do what we can without raising taxes and burden our residents even further. So at some point, we have to be able to take some of these private funds, because they keep our budget where they need to be. I think I'll stop there.
Thank you, Dr. Silva. Okay. Mr. Isaacson, is that it for you today?
That's for time's sake, yes.
Okay, thank you.
More to come.
Okay. We'd like to move on now, and I'd like to ask David Young to present his resolution.
Thank you. It is Resolution 23-1007, requesting removal of WHO, the World Health Organization, and UN information from all Kane County Health websites, printed media, and digital media. Whereas the Kane County Health Department has digital media, videos, digital print, other, and printed media displaying the World Health Organization, United Nations, and other non-US entities. Whereas the public has been present at public health committee meetings and have asked about removing all references to non-US entities as it relates to the health of Kane County citizens. Whereas Section 2-48A6 of the Kane County Code provides that the Public Health Committee shall have jurisdiction over all matters concerning the county board's function as the Board of Health. Now therefore be it resolved that the Kane County Board formally ask the Kane County Health Department to remove all references to the World Health Organization, UN, and other non-US entities on all digital and printed media passed by the Kane County Board on August 8th, 2023. And I'd like to make a motion to bring this to the committee.
And do we have a second?
Juby seconds.
Okay. And do we have a discussion? Thank you, Ms. Juby. Yes, Ms. Juby.
Okay. So first of all, David, I want to thank you for having that on the agenda because it allowed me the opportunity to look up stuff that I wasn't remembering correctly from high school. So thank you for that. In my reading of the United Nations and of the World Health Organization, I was struck by their 5 tenets of maintaining international peace and security, protecting human rights, delivering humanitarian aid, supporting sustainable development, and concentrating on human rights, which they define as the right to life and liberty, freedom from slavery and torture, freedom of opinion and expression, and the right to work and education, which reminded me very much of our Declaration of Independence. When I looked at the World Health Organization, well, I need to step back because I didn't really understand or remember how the United Nations was set up. And the fact that there are 5 nations that have permanent veto power over any one item that comes in. If one vetoes, it doesn't go anywhere. And the United States has that. And so if the United States feels that they're losing their sovereignty, they have the ability to veto it and have it stop. And that's not what the resolution that was presented, which is a whole nother thing, doesn't cede the authority of our sovereignty for that. It just puts it together. But anyway, so the World Health Organization was founded in 1948 to ensure that there was a healthy future for everyone, no matter where they lived or who they were. It prioritized improving health and achieving equity in health for people worldwide, which is a very noble goal. They develop a database to research disease and health policy with the goal of saving as many human lives as possible, very similar to what we do in our Kane County Health Department. They set international standards for monitoring and implementing global health policies and practices because we're better together than we are individually. They advocate for research-backed science and ethical behavior within the global health world. Everyone wants data. They want data to be meaningful, and they want to know it's not being abused by the people that are using it. And they monitor and assess health trends and concerns, such as trends in malnutrition and preventable diseases, child and maternal mortality rates, spread of disease, aging populations, and sanitation. Kind of similar to what Dr. Silva said, one thing breeds a lot. So if you're homeless or if you don't have food, you could end up with mental health issues. You could end up with compromised health things, which are much more costly for governments. So I looked into why is this important to the United States? Why do we feel we need to be in the United Health or in the WHO? And basically, it contributes to a broader development of goals such as advancing a free and peaceful and prosperous world, which is what the United States stands for. People being able to have their own democracy and their own ability to be peaceful and prosperous. It contributes to foreign policy priorities such as promoting democratic institutions, upholding universal values, and promoting human dignity. We've gone to war over human dignity. It addresses national security concerns by protecting Americans from external threats, sustaining a stable and open international system. These were all organized by the Kaiser Family Foundation, not necessarily known to be a partisan issue. So because of all those things that I either hadn't remembered or hadn't known, but I found out because you made me look at this, which I am so appreciative. And I really do. I'm not going to vote yes, but I really appreciate the opportunity to be able to take my 2-day deep dive to realize that these things that the WHO is asking for are very similar to the things that Director Isaacson just said we're trying to do with mental health. We're trying to take a whole approach to it. And I appreciate that. And so sadly, I won't be supporting your resolution, but I really appreciate the opportunity to have this conversation. So thank you.
Any other discussion? Yes, Dr. Silva?
Thank you so much for that refresher because I didn't remember myself a lot of those things. And I think in theory, who isn't behind that? I think in theory, we're all behind that. I think what folks are saying though right now is, and they've taken the time to come time and time again. So I like the fact that we're discussing this because we need to hear what folks are thinking and how, and what their points of view from all angles and sides. And so what I hear folks saying is that we need to do our own thinking and our own, and time again, I hear people saying that we need to be independent in our thinking and in our actions. And while none of us, I think here in this room is in favor of things such as human trafficking or the abuse of children, the fact is we have not been successful at stopping this. In fact, we're having the greatest epidemic, or at least the epidemic is now being known to exist than we've ever had. So at any other time of enslavement, we have more people in those situations than we've ever had. So I guess what I hear folks saying and what I can agree with is that we do need to do our own thinking. And just as Director Isaacson said, is look forward to how do we fix things in our county. I can't say I agree or disagree with this resolution yet. But I do believe that the conversation is important and I do see why.
Yes, Madam Chair.
Thank you. This is related, but not directly regarding this, but it's a direct correlation. We had speakers who talked about the COVID vaccine. And recently, the Supreme Court ruled on that recently, and that I believe was in the end of June when that happened. It was about the same time as just a reference point when the Supreme Court voted down Joe Biden's proposal to pay back student loans. So that's the reference point. So within that period of time when they were making their judgments. One of the things that they did support was making sure that was brought to suit that if you are a public health worker, that you would be mandated to get the COVID vaccine. So if we are looking at not supporting that, and with the World Health Organization supporting, had supported during the time of the pandemic, the vaccine, our Supreme Court has endorsed it. A very conservative Supreme Court has endorsed it for public health workers. So I'm just putting that as a side note to all of this.
Thank you. Yes, Mr. Linder.
Not on the committee, but I did want to note in meetings for the last few months, I've had people suggest that the UN or the World Health Organization was dictating health policy in Kane County. With nothing further from the truth. They were used as an authoritative source of someone who agrees with a point of view that the county has. There's a I don't know if it's still there, there's a board out here suggesting people quit smoking. Well, there are a lot of people who think they can smoke and that it's fine, and nobody's saying they can't. But the World Health Organization or the UN did not come into Kane County and say, you have to ask people to stop smoking. There was a determination that we ought to promulgate that opinion that smoking is a bad thing and that you ought to quit. And these happen to be some sources who agree. It's not these groups coming in and dictating any policy here. Now, where we go from there, I don't know. I just don't think We need to be, every time we quote a source or a group that agrees with one of our policies, I don't think we have to vet whether or not somebody's going to hate that. It's just my opinion.
Yes, Madam Bates.
Thank you, Mr. Chairman. I believe that we're calling it the WHO. I thought that was a band. Or the WHO is the acronym I usually go by. It's the World Health Organization. And I believe that the world working together for better health is what we need today. We can use all the help we can get for building the health of Kane County, Illinois, the United States, the whole world. We're always stronger when we work together. Thanks.
Thank you. Yes, Mr. Young.
So I brought this request to the board because Ken, the first speaker that was here, had pointed it out to me. We were in the lobby waiting, and he said, "Look, why is the World Health Organization on the screens out here? Wash your hands, stay a certain amount away." And I said, "I don't know." And they brought it up over the last several meetings, and then I looked into the World Health Organization, and I did my own research, and the World Health Organization is funded by many countries. 20% of the World Health Organization funding comes from what they call membership countries, including people like China and Russia. The other 80% of the funding from the World Health Organization comes from private donations. And currently, the largest private donator to the World Health Organization is the Bill and Melinda Gates Foundation. And I think you guys have heard what Bill Gates thinks about population. He is for depopulation. He has videos all over talking about depopulation and how the world has too many people in it. So now you're talking about the World Health Organization that accepts donations and is funded. He is going to have the seat at the table, and he will dictate what the World Health Organization will do. And that's just how it is. The United States has many organizations that are capable, way more capable than the World Health Organization. And we haven't even talked about them. CDC, NIAID, NIH, FDA. Those are just a few of our great federal agencies that are working to keep us protected. Why do we have to go outside the United States to protect our citizens? The people here in Kane County are concerned about this. I'm concerned about it. Why do we need to have World Health Organization that's funded by Bill Gates dictate policy to Kane County? So I agree with Ken. I agree with him 100%. We should remove the references to the World Health Organization. The board also needs to recognize that its duty is to the citizens of Kane County. There is no duty or obligation to the United Nations, World Health Organization, or World Economic Forum, and any attempts to serve those interests are a violation of our oath of office that we took.
Any other discussion?
Lastly, if you do vote for this, then you are voting for our entities that already exist in the United States to handle our epidemics. And if you vote against it, then you're for the World Health Organization and against the CDC and the FDA and all the other organizations we already have set in place.
Point of order.
Yes.
That's misinformation, ma'am.
Yes, thank you. I agree. That was an opinion.
That was an
You-
opinion.
Yes, it is your opinion. You cannot know what the motivation is of a person voting. So that was your opinion.
That is my opinion. Yes.
Madam,
Gums.
yes, Gums.
Actually, Mr. Tarver had his hand up, so.
Okay,
I
Mr.
don't know.
Tarver?
Thank you. I was listening and have been listening. I'm not on the committee, but I have been listening, and I just, I fact checked everything while people are speaking. So just for point of information, somebody referenced the study from the University of Michigan. The University of Michigan's website and health and research often refers to the WHO and the CDC. They're not an independent thinking only organization as well. I bring that up because I don't think that what you're asking for is one relevant, because we don't have the information on our sites any longer, one, but we can't be completely independent when it comes to world issues. So if you're citing information from one study that utilizes another organization, but we can't do so, that's kind of a contradiction to me. So it's not adding up. Also, the World Health Organization does not dictate what any sovereign nation does. All the amendments that are being put forth, none of that says that Kane County must do anything. And it took me 2 minutes to Google that. Also, the Bill and Melinda Gates issue about depopulation is proved to be false.
Sure.
Mr. Young.
There are plenty of videos with Bill Gates talking about depopulation. And then there are.
Okay, is there any, yes, Mr. Tarver.
Madam Chair, thank you. Tarver here. A lot of great things have been said today. Director Isaacson, I just want to thank you for all the work that your department is doing. I look at this as a collaborative event or opportunity. If we do not collaborate with our interagencies, whether it's local, national, global, how do we better serve our community? So I look at it that way. And when we take those opportunities away from residents on how they can gather information and take away the opportunity to freedom think for themselves, I think we're not doing ourselves and our community justice. So some great comments have been shared here today. And Mr. Young, I appreciate, I sent you an email and I appreciate the response that you shared in educating us, just like Madam Judy had shared as well too. And that's all my comments are for today.
Mr. Isaacson, do you have anything to share?
Just a quick comment. I think one concern that I would have about a resolution like this as the department head for the public health department is it takes away a potential resource and a potential tool. So most of the information we get is coming through U.S. sources, right? So as the organizations that Mr. Young just mentioned, the Centers for Disease Control and the Illinois Department of Public Health, that's where we get many of our powers, our public health powers here at the local level. However, sometimes there are things occurring that are really global in nature. And COVID is an example where we regularly would look at what was happening in other countries. That information wasn't necessarily coming from the CDC. We had to rely on other places in the world to get it. The CDC and some of the organizations that Mr. Young referenced work very closely with the global community because frequently diseases are originating in other parts of the world. So Zika virus is one example of something that when that was coming a few years ago, a lot of our initial information was coming from international sources. We didn't have cases in the US, but we needed to learn about it because we were worried about it coming to the US and we knew that US citizens were traveling abroad. So in that case, my only concern as a department head for myself and whoever comes after me in this job is if we prohibit accessing certain sources of information, that's a limitation. I will say, however, in principle, as we've discussed, most of what we put out absolutely should be from US sources. I completely agree. I think that, the health department didn't put up the hand washing thing that I think kicked this thing off in the lobby there. To me, it was relatively benign and it was appropriate information about hand washing. But as we discussed, we easily could have had a CDC document up there. And I think that would have been preferable. So in principle, we're going to look to US sources, but we live in a global community. We have US citizens who are traveling all over all the time. Almost 1 in 5 Kane County residents was born in a foreign country. So we are part of the global community. I can't speak to the UN or the Bill and Melinda Gates Foundation, but just in my role as this, I'd hate to have that limited is my only comment. So thank you.
Okay, I see Mr. Doherty, you have your hand up.
Yeah, just real quick, I want to thank Ms. Juby for a tremendous amount of great information. I think if the World Health Organization stuck to those principles, I don't think Mr. Young would have been bringing this resolution. The problem is that they did not stick to those principles in the way that they operate. And it's my understanding that this would not prevent the health department from using WHO sources, but it would remove a tacit endorsement of the World Health Organization by putting their logo on our paperwork. And the fact is, like I said, they stepped outside of their bounds of what their guidelines were. And that's where everybody has a problem with it. Not that they have some useful information. It's that they put out some propaganda, and that was a problem. Thank you.
Thank you. Yes, Dr. Silva?
I would just like to say, I do hear you. I do hear what you're saying. But now I'm a little confused because what the resolution actually says, Mr. Young, is requesting removal of WHO and UN information from all Kane County Health websites. So I think that has the implication of we can't use their information. I would be far more likely to support something like this, perhaps after a discussion, if it said removal of, I'm losing the word that I'm thinking. Sometimes when you speak two languages very well, I have that issue. But the reference. So when you're, I think it would be a a statement with less implications, requesting removal of WHO and UN references. But I don't know that we can remove the information because the information much of the information that they are putting out there is information that we would have from US and individual sources ourselves. So I don't know if we can do this. I mean, Mr. Young, I don't know what you think.
Well, I think we can remove it for sure. You're talking about using an entity out of Geneva, Switzerland. Okay, when the FDA and the CDC, they will be speaking to the World Health Organization themselves. So, you know, they are going to be using that data. So we're just asking for that World Health Organization not to be filtered into the Kane County information. But in the end, we're going to get it anyway because the CDC and everybody else is talking to the World Health Organization. So,
okay, I think we need to wrap up this discussion. And what I would like to
Madam
say,
Chair, I'm so sorry. Would you allow, please, Director Uche has a comment. Would you allow her?
yes, I'm sorry. Go ahead.
Good morning. This is Uche Omuta, the Director of Health Protection at King County Health Department. I just want to state that just using an example of Ebola, when we had Ebola, that occurred in a country, a sovereign country that we have totally no authority to go into. WHO allows works with the CDC to go into that country to offer, services. And then we learn from the information that comes from there. WHO declared Ebola, the outbreak, over. We couldn't declare that outbreak over in Guinea, where it started. We had to rely on the WHO to do that. And when they declared the outbreak over, then CDC was advised, and they decided that for our own purposes, that the outbreak was over. Now, we can't go into a sovereign country and do research or without their permission. And we don't know what the government in that country is all about. We need a global organization that has credibility and does extensive research on it, that works with CDC to get it done. And that's how we rely on that. Now, if we're going to put out information regarding the Ebola outbreak, and we cannot reference WHO that declared that outbreak started or ended, we're going to be using information that doesn't belong to us without referencing WHO. So who do we reference in that situation?
Are we talking about Kane County only? You're talking about a foreign country.
No.
So in your situation, aren't we? I don't know if that applies here because we're specifically just talking about citizens of Kane County. You're talking about a different.
Mr. Young,
country.
I would like to say that we've had a lot of good discussion this morning and a lot of very good points. I think it's time to to come to a vote.
Okay.
I would like to say that disease does not know boundaries. We live, whether we like it or not, we live in a global community. We have a global economy. We have, like Mr. Isaac said, 1 in 5 of our citizens in King County were born in another country, which means they have family that they travel to see and come back. Disease does not, stop at the borders. So we need to be able to have resources. Right now, they're having an epidemic, or well, excuse me, that is absolutely the wrong word. They're having some cases of malaria in Florida. And we need to know when things are happening and when they're coming to us. And I think, and this is my opinion, when we remove any references to our sources of information, it's like removing the footnotes on in our term papers. And I don't think that we should be doing that. I think people have the right to know where the information is coming from. We contact them for information and they give us back information. They're not dictating to us. And because we listen to them does not mean that it is affecting our sovereignty. We still have jurisdiction over what we put on our how we govern our country. And the Public Health Department of King County takes its marching orders from Illinois Department of Public Health. And so when we talk about the citizens of King County, we're talking about global citizens as well. So I think that, and one more point I'd like to say, I heard what you said, and I've heard other people say about the screen out in the lobby with the reference to the World Health Organization. I contacted Roger Fonstock, and he assured me that that was removed 2 weeks ago. So that is no longer up. And, we have addressed this earlier in this committee, and we told you then, we announced to everybody then, that we were going to be moving forward, that we removed everything from the website about the pandemic. COVID is not done, but the pandemic is done. We are now moving forward. We have greater issues, not greater issues. There was nothing greater than the pandemic, but we have other issues that we want to handle and address in King County. And Mr. Isaacson so eloquently told us about some of the things that are going on and some of the things that will be going on. So I would like to announce that I think this proposal is moot because we have removed all the references on the website. And I'd like to ask a second for that declaration that this is moot. Can I have a second from anybody?
I don't understand. Yeah, I don't understand.
I'm sorry, I need some clarification. Are you modifying this resolution to declare that it is not relevant?
Right.
Mr. Parliamentarian, I don't know how we handle that.
As I understand it, the purpose of the resolution was to remove information from a website. And if what the chair says is correct, if it's been removed, then it would seem to be moot and therefore not really germane to the business of the committee. I think that would be a ruling from the chair, not necessarily a motion with a second.
Oh, okay.
And then if the ruling of the chair is disputed, someone could appeal that decision, and then it would be the committee's vote as to whether to sustain the decision of the chair or not.
Thank you.
So then, I will repeat I will correct what I said. I think that this resolution is moot and we should not vote on it today. Is that the correct way to say it?
But say it's not germane and therefore it's out of order.
This resolution is not germane because we have removed the references to the UN and the WHO. And so this resolution is out of order.
Point of order to the parliamentarian.
Yes, Mr. Darty.
Yeah, it is moot at this moment, but that doesn't stop them from putting the logos right back up on the website or any new flyers that are printed going forward. So that how is the resolution not moot, or how is the resolution moot if it could all come back tomorrow?
Mr. Doherty, the resolution states that the Cayuga County Health Department to remove all references. That is what the resolution says. It doesn't say anything about the future. So I guess I think that it doesn't deal with the future, and I don't know that you really could have a resolution that says I'm not sure what a resolution would say. I mean, would that mean that if there was an alert from the World Health Organization that there is Ebola outbreak at Heathrow Airport, that you couldn't put that up on the website? That would seem to be something that would be inappropriate and something that would interfere with the discretion of the Illinois Department of Public Health. So what happens if the Illinois Department of Public Health puts an alert that says we received information from someplace else? So anyway, I think the issue is simply at this point, if the chair's made a ruling, if there's a dispute about the ruling, we would proceed in that fashion.
Well, there is a dispute. I mean, they had a speaker that talked about all of these links that have already been, they're not necessarily removed. We had a speaker that talked about that.
Young,
and-
the procedure properly would be the chair has ruled it's moot. A member of the committee may say, I appeal the decision of the chair, which is not debatable, but immediately goes to a vote of the committee.
I appeal the decision of the chair.
Point of information, Mr. Parliament, on your explanation, you stated that the resolution states requesting the removal of here's that word that I was couldn't think of before. Of reference. You stated that the resolution states the removal of reference, and it actually states the removal of information. And I understand that as two very different things.
The title says information, but the now therefore it be resolved, which is the action that the resolution says. It says formally asked to remove all references to WHO, UN, and other non-US entities on all digital and printed media. So the word information does not appear in the direction of the resolution, only in the title.
So to stay uniform, I would suggest that we say UN reference instead of UN information.
Well, but the chair has ruled that the resolution is moot. So there would be no action to be taken unless the decision of the chair is overruled. In which case.
So in my appeal, what does that do?
So the Madam Chair, the proper procedure then would be to say, shall the decision of the chair be sustained, yea or nay? Yes is to sustain the chair's decision. No is to overrule the chair's decision.
Is there a discussion first?
No, it's not a debatable motion.
He needs a second.
Do I?
You need a second.
Right.
Do I need a second on my appeal?
No.
Okay. Okay, so could you recap what happened here?
Okay. The chair has ruled that the motion is no longer germane because it is moot because the information has been removed.
Point of order there, because Madam Chair referenced a screen. The resolution talked about all digital and printed media. How do you know that all digital and printed media, those references have been removed?
Point of order, this is not debatable. It needs to be voted on now.
Why?
Thank
It's-
you. This is
doesn't
not
make sense.
debatable, Mr. Young. You're trying to debate it.
I would like to say that we have no control of, you do not say future printed material, you are saying printed material.
Right, correct.
So that would be impossible for us to, on things that are currently printed and out, we would have no way to remove references to any of these sources. So when
Correct.
you say printed material, it does not say future material to be printed.
Mr. Tepe has raised a point of order on the point of order.
Point of order correction. The World Health Organization is still annotated on the Kane County Health Department website. So saying it's removed is a lie.
Where is it?
Can you give us a
This is for debating.
references to where?
You guys are losing. this.
Point of order.
Yes.
We
Madam.
are still debating something that we technically should not be debating. If you withdraw your determination, would that then allow us to be able to talk about this some more? Because it's clear that we still have issues, and I'm not sure we shouldn't just vote on the entire resolution, because this is becoming very confusing.
Okay. Okay, I think that I'm listening to what everybody's saying. I will withdraw my declaration or whatever, that the resolution is moot, and I think we will proceed to a vote. Okay. So, so if there is no further discussion, we will vote on resolution 23-1007. Okay, clerk call roll.
And this is for the passing of resolution 23-1007. Juby,
Juby, no.
Silva,
Please come back to me.
Tarver,
Tarver,
no.
Williams, Young,
Yes.
Sanchez, Strathman,
No.
Silva,
I'm gonna have to vote no.
does not pass with 1 yes.
Okay, thank you. Thank you for the great discussions. Have any old business? Okay, I'd like to have a motion in order to, motion a second to place reports on file.
Tarver moves.
Okay,
Second.
thank you, Tarver and Young. Is there an executive session that's needed? Oh, vote on the report, sorry.
Juby,
We're voting on replacing reports on file.
Juby, aye.
Silva,
Yes.
Tarver,
Tarver, yes.
Yes.
Strathman,
Yes.
approved.
Okay, any new business?
Yes.
Yes, Mr. Young?
I wanted to follow up on, I have it written down here. Last month, we had a contributor, Roxanne, was talking about her concern about passing resolution 23-724, which seeks to hire a communicable disease surveillance coordinator. And she questioned surveillance and spying on the citizens. And so I don't know if you remember this, but I asked Mr. Isaacson, is that true? Can the county surveil people and quarantine people as, and he said yes. And so I sent Director Isaacson an email and he sent something right back to me. I want to share that with everybody real quick. I just said, can you send me the state statute that authorizes the Kane County Health Department to surveil individuals in quarantine based upon vaccination status or sickness? And his response was, I've attached a CDC PowerPoint. that provides a solid overview of public health surveillance. It is pretty detailed. And then he also said, here's a link to the Illinois statute that outlines state authority around public health issues. And I'm going to forward this to everybody on the committee. It was sent to me and Miss Madam Chair. The CDC PowerPoint, page 1, it says Public Health 101, Introduction to Public Health Surveillance. Found that kind of odd. Public Health 101, which is surveilling its citizens. Item number 19, it says the legal authority for conducting public service health surveillance. And I'm just going to read on the PowerPoint. You guys will get this, but on the PowerPoint presentation, they have presenters notes. So they tell you what to say. So here's what you're supposed to say. We've learned about the role and use of surveillance. Now let's take a look at its legal basis. In the previous New York Times article, data related to a person's illness or behaviors were collected as part of surveillance efforts. You might have to ask yourself, how can public health officials conduct surveillance without a person's permission? Or how do public health authorities decide if they have the right to conduct surveillance in a particular circumstance? Legal authority for states to conduct public health surveillance is based upon the U.S. Constitution in 2 specific clauses: general welfare and interstate commerce. The federal government is charged with promoting the general welfare of the people, and it has authority over interstate commerce. CDC can respond when a disease has interstate implications because of the Commerce Clause. Otherwise, CDC typically must be invited to a state to conduct surveillance or
In the
investigations.
interest of the time, can you conclude what you're?
I will. I don't know if anyone knew this. I have one more thing. The CDC has the ability by the General Welfare Clause and the Interstate Commerce Clause to surveil you and your family and whoever else, period. I thought that was overreaching, but I'll send this to you guys. You can make your own thought. Illinois statute, the state Department of Public Health has general supervision over the people of the state. It has supreme authority in matters of quarantine and isolation. The department may order a person or group of persons to be quarantined or isolated, or may order a place to be closed and made off limits to the public to prevent the probable spread of a contagious or infectious disease. The department may order observation and monitoring of persons to prevent the probable spread of a dangerously contagious or infectious disease. This is all part of Illinois. I'm going to send this to everybody. This is Illinois statute. So this, and Mr. Isaacson was right. It gives them the authority to do all of this stuff. And I didn't know all of this, and I don't know if you guys know all this. So I'm going to send this to you guys. And that was what I wanted to bring up. So thanks.
All right, thank you.
Madam Chair,
Information is always good. Dr. Silva.
very quick 30-second comment. I actually used to work in direct observation therapy way back when I first worked with the health department. And it can be as simple as hiring somebody to watch these folks take their medicine because for some reason they don't take their medicine. And so we're trying to prevent an epidemic of tuberculosis or something like that. So it could be as simple as, I just need to see you take your medication, which is what I did.
Thank you. Madam Gomes.
Thank you. I just want to for folks that may not be familiar with this goes back a long time, the surveillance, and something that you can maybe wrap your head around is in the law enforcement and medical field, law enforcement officers often needed to know if somebody was infected with tuberculosis, or if somebody was infected with MRSA, or if somebody was infected with HIV/AIDS. That information was extremely useful to the first responders so that they could go in with their protective gear on. And it had, I mean, I started in 1997 and that was, or 96, and that was something that was in place way back then for their protection. So I do understand the concern, but it's extremely important that we protect those folks. And I think that we can only do that by surveillance.
Okay, thank you.
Madam Chair, one quick comment, and I passed along, and you'll see in the PowerPoint, and my intent was to really show how we use these terms in public health, both surveillance and observation. are not necessarily the same way we think of it as being spied on, say, by the government. So when we conduct surveillance, we're really looking at disease states across a community. We're not set up in a van across the street from somebody, you know, watching through their window. And so that was and it's a big PowerPoint presentation that I sent, but just to show this is what we mean. And this is an educational tool provided by the CDC. This is what we mean in public health by surveillance. So its connotation, I think, is much more negative than it actually is, which I think is a legitimate thing to question. But we're not spying on people. We're monitoring rates of disease across the community.
So the black helicopters following?
No,
you?
yeah. Well, that's separate. Yeah, no.
Okay, thank you. I do understand that we need to go into executive session. Is that correct?
Yes, for the purpose of considering your closed session.
For the purpose of reviewing closed session minutes. So can I have a motion and a second to go into closed session?
Tarver moves.
Tarver and
Okay.
Young? Roll.
Juby,
GBI.
Silva.
Yes.
Tarver,
Tarver, yes.
Young,
Young, yes.
Strathman,
Yes.
approved.
All right, for those online that will be joining us in the closed session, please accept those invites. Be aware we are live streaming, so until I give you the word that we're all together, please be aware everything will be going out to the public on YouTube. Accept those invites, even if you're in the room here and joined us on your computer.
I already did new business. We didn't.
Holy crap, I'm so sorry.
Doesn't matter. Thank you.
Okay, all right.
They don't want the World Health Organization.
I have 3 people that have not accepted their invites yet. Please accept your invites, even if you're in the room.
Yes, did, and some advice, so I don't care. Good morning. Okay.
Oh, sorry.
I'm still missing 1 individual. If you do not join, you will not be able to join later.
And I believe it too. So
No, right, I just-
it's fine. I mean, it is what it is. So, and then in the end, you know, everyone's gonna have their vote. And you know, if those votes are gonna be looked at by the public, who knows?
Tried to save you steps.
So. Motion to. closed session.
Motion to release closed session minutes as set forth in the CLA.
Imagine that.
Thank you.
That was kind of silly, really, but. See, minutes released are just gonna say that
All right, you are in open session.
December.
So I need to ask for a motion.
Yeah, well, now, first off, you have to, are we
Roll call.
back?
Are we?
Okay,
Digitally, we are back. So now we are going to
establish forum again, or
establish our quorum again, take roll call in the room. Clerk, please call the roll.
Juby,
Here.
Silva,
Here.
Tarver,
Tarver here.
Young,
Here.
Strathman.
Here.
You have a quorum in the room.
Now, I would like to ask for a motion and a second to release the minutes as set forth by the state's attorney in Exhibit A.
So moved.
Second.
Okay, that's Juby and Tarver. And do we vote on that, Jen?
you can call for discussion.
Is any discussion? Pay attention for this tomorrow.
I am.
Okay, so clerk, please call the roll. Okay.
Juby,
Aye.
Silva,
Yes.
Tarver,
Tarver, yes.
Young,
Yes.
Sanchez. Oh, Strathman
Yes.
passes.
Okay, now is there, we do have one more speaker, or maybe two, excuse me, speaking off agenda, but first we're going to get to new business. And then we will finish with our, pardon me?
You did new business already.
We did new business.
Mr. Young brought up some new business before we went into
Yeah,
executive
that was
session.
the Mr. Young's discussion.
Yeah, and I shouldn't have done that because
Well,
that was,
I called for old business
Oh, you
though,
did.
at that time. And this is now new business.
okay, well then,
So
I
this
guess
is,
that was kind of old business anyway, because it was from a conversation.
it was. It
From
was.
last month.
This is now new business, so I'd like to, I'd like to move along and do new business. And I think we're going to ask Michelle Gums to present our new business this morning.
Thank you for the invitation to read what we're working on here. This is going to be a resolution. I don't have the resolution number here, but it's in reference to supporting Ethan's Law. Ethan's Law, we had it in legislative last month, or maybe 2 months ago. Ethan's Law, in short, is requiring responsible gun owners to use safety locks on their weapons if they have children or somebody with a mental issue in their homes. As a gun owner myself, I fully support this. And we did a little resolution. So whereas the Kane County Board recognizes the importance of promoting the safety and well-being of all residents, particularly the youth of our community, and whereas the tragic events surrounding the untimely death of Ethan Song, a young resident of our country, have highlighted the need for stricter regulations regarding firearms storage and access. And whereas Ethan's Law is a proposed federal legislation aimed at preventing unauthorized access to firearms by ensuring the safe and secure storage of firearms within the households. And whereas Ethan's Law advocates for the responsible gun ownership and seeks to reduce the incidence of accidental shootings and self-inflicted injuries, especially among children and vulnerable individuals. And whereas Ethan's Law proposes that firearm owners be required to securely store firearms in a manner that prevents access by unauthorized individuals, including the use of trigger locks, cable locks, and other secure storage mechanisms. And whereas Ethan's Law also promotes education and awareness programs to educate the public on safe firearm storage practices and emphasizes the importance of responsible firearm ownership. And whereas the passage of Ethan's Law would contribute to enhancing public safety, protecting our community's children, and reducing the likelihood of tragic events involving firearms. Now therefore be it resolved by the Kane County Board that we express our full support for Ethan's Law and urge the United States Congress to promptly consider and enact this legislation to ensure the safe storage and responsible ownership of firearms.
Oh, yeah. I'll be leaving in about an hour.
Okay, Chris, we'll note that.
Chris.
Oh, goodbye. Goodbye, honey.
You're welcome. See you later. And just, Madam Chair, if you don't mind, this is something that is extremely important to me. I know we're going long, but my meeting's next, so I can do that. So as a child, I just want to share this information and why it's important to me. I am a gun owner. I'm a concealed carry owner. I'm also a responsible gun owner. When I was a kid, I learned how to store my weapon, how to use the weapon. I had a cap gun. I had a lunchbox, and I had to take the caps out of the cap gun. I had to put the gun in the lunchbox, and then I had to put it up. That was how I was taught as a child to secure my weapons and to be a responsible gun person. Now, life is so different than it was almost 50 years ago now. Anyways, so we have to adjust how we do things in the household. If you look at the statistics for gun violence, obviously they're astronomical, but many of those things that we don't talk about all the time are the people that shoot themselves every single day. And of that demographic, most of those are teenagers. So I, as a gun owner, support this and ask this committee for the health of our county to support this as well. I think any reasonable gun owner would say this is a good thing.
Because it wasn't on agenda, we can't do a vote on
Correct.
this. But we wanted to bring this forward. The purpose was to get the endorsement of the Public Health Committee as we go forward to the committee process with this. I think, thank you for that information. Any questions for Michelle? Yes, Madam.
I have a question. What is the next process? Where does this,
Thank you.
where does it go from here?
The next step for you will be what?
Well, we've got to get it into the system properly, which it's not, right? And then we'll probably push it through to judicial and public safety.
Is this on your committee agenda?
It is not on my committee agenda.
I mean, because it's addressed to
Yeah,
legislation.
right, which is today. So judicial, I'm hoping.
So for clarification, Tarver here, will it be introduced at legislative to pass the resolution and then forward it along? Or are you asking this
Yes.
committee to forward it along?
No, we're not asking, I'm just asking for consensus for support. That's
Thank
all
you.
I'm asking for. There's nothing to vote on. I just wanted to bring it to you because it's a public health issue. And I wanted to share it while you had a meeting.
So we can give her a consensus for support?
When you give a consensus, you're really sort of voting without voting. So I think it's just perhaps
Just for information.
Informational then.
give her a round of
Information only.
applause or something.
Thank you for that presentation.
You're welcome.
And now more to come.
Can I make?
Yes, Mr.
So,
Isaacson.
so just quickly to support what Ms. Gumbs is saying, we did have 22 fatalities in Kane County in 2022 related to gunshots. 7 of those homicides, 14 were self-inflicted. One was undetermined. And I think it's just, I really want to underscore, and Ethan Song's story comes up because he was at someone else's house where there was an unsecured gun, where then he accidentally shot himself. And I think that's the key thing is many people can control what's in their house, but when they send their children over to somebody else's house, that can be scary. You don't know what's happening there. So this is something that can be very protective for people. And then also in terms of how we can make it easier to support something like this, the health department is providing free gun locks. So if there are gun owners who would like gun locks, we can make those available for no cost. They've been made available at no cost to us by the state of Illinois. So we really encourage anybody, and I know this pertains to specific legislation, but we want to make sure we can have, as Ms. Gumbs said, so that people can be responsible gun owners. Thank you.
Thank you.
Madam Chair.
Yes, Ms. Pace.
I appreciate this, Ms. Gumbs, because it correlates public health with gun safety. And that's an important connection that we have to make. Public health can be in there. It's in our lane. Thanks.
Okay. Now I want to go to our last speakers. Thank you very much for your patience in waiting and for the new, how we're doing the public speaking. So I now have the names of people who are speaking off agenda, and you will have 3 minutes. First, I have Lori Powell. Is she still here?
She spoke earlier.
She had to leave. Okay. And then we have online, we have Mr. Peter Kraus.
Good morning. Can everyone hear me?
Yes. Yes.
Okay, thank you. Good morning. My name is Peter Kraus, and I'm a resident of Chicago and a retired actuarial analyst. I was invited by your board member, David Young, to provide a comment to the committee because I had a friend who died 1 week after having received a COVID-19 vaccine. My friend's name was Norman Guter. He was vaccinated on Monday, May 3rd, 2021 with the Johnson & Johnson vaccine. Norman died on May 10th at the age of 67. There was no autopsy done, so while it cannot be proven that the vaccine caused his death, it cannot be ruled out either. If we look beyond Norman's death to our society as a whole, there were steep increases in excess deaths, disability, and injury that occurred in 2021 and 2022, and these increases were not due to COVID infection that has been determined. Additionally, these steep increases did not occur in 2020, the first year of the pandemic. The evidence for this is based on US government data, which has been looked at by an analyst by the name of Ed Dowd. He finds that there have been the following increases unrelated to COVID infection: 300,000 excess deaths, 1.3 million additional disabled persons, and 27 million additional injured persons. Dowd estimates the total cost to the US economy at between $300 billion and $1.5 trillion. He states that these increases point to a global health crisis and that there is a pandemic occurring now that dwarfs the COVID pandemic of 2020. He asks the following question: If these increases we are seeing were not caused by the COVID vaccines, what were they caused by? His analysis can be found in his title, Cause Unknown: The Epidemic of Sudden Deaths in 2021 and 2022. As a postscript, the J&J vaccine that Norman received was essentially taken off the market in 2022 when it was allowed only for adults for whom no other option was available. This removal of the product was prompted by its risk for a dangerous clotting condition called thrombosis with thrombocytopenia syndrome. Thank you.
Thank you. And now we have Dr. Sherry Bresnahan.
Good morning. Dr. Sherry again. What has changed, excuse me, in the last 30 years? Since 1990, there has been an 819% increase in ADHD, 299% increase in Alzheimer's disease, 2,094% in autism, 10,833% increase in bipolar disease in youth, 1,111% increase in celiac disease, 11,027% increase in chronic fatigue syndrome, 280% increase in depression, a 305% increase in diabetes, 7,272% increase in fibromyalgia, 702% increase in hypothyroidism, 78% increase in lupus, 449% increase in osteoarthritis, and 430% increase in sleep apnea. 1,884 athletes worldwide have suffered cardiac arrest or serious issues. 1,310 of them are dead since the COVID injections. According to the Society of Actuaries, to follow on the gentleman's heels, in the last 9 months of 2020, the total deaths were 19.8% higher than the baseline expected and 5.1% higher excluding COVID. For the full year of 2021, these respective numbers were total deaths were 22% higher than the baseline expectation and 3.6% higher excluding COVID. It's noted that the Amish are largely unvaccinated. You won't find ADD with PANS, or with epilepsy. You won't find any of these chronic conditions in the Amish. The US has been studying the Amish for decades, but there's never been a report out to the public. After decades of studying the Amish, there's no report because the report would be devastating to their narrative. It would show that the CDC has been harming the public for decades and saying nothing and bearing all the data. Control group data, vaccinated versus unvaccinated, the Amish. Chronic conditions, 60% versus 5.71%. Arthritis, 16.67%, 0%. Heart disease, 48%, 0%. Diabetes, 10%, 0%. Asthma, 7.7%, 0%. Autism, 2.5%, 0%.
Have 15 seconds.
ADD, HD, 9.4%, 0%. Cancer, 6%, 0%. Thank you.
Is there anybody else that did not? Yes, ma'am. Would you like to come? Oh, okay. Thank you. I wasn't sure of your name. Thank you.
That's all right. Thank you. I would like to address a topic that has been brought to the forefront of all our citizens of the county and our country. A new comprehensive study has found that no Amish children have been diagnosed with chronic conditions which widely impact the rest of America. This study, presented by the Vaccine Safety Research Foundation founder Steve Kirsch to the Pennsylvania State Senate, it was calculated that for the Amish children who are strictly 100% unvaccinated, typical chronic conditions barely exist, if any at all. The chronic conditions which many vaccinated children and swaths of Americans suffer from include autoimmune disease, heart disease, diabetes, asthma, ADHD, arthritis, cancer, and autism. The current population of the Amish people in America is quickly approaching 400,000. The largest concentration of Amish citizens are 90,000 in Pennsylvania and 82,000 in Ohio. Amish communities have settled in as many as 32 US states. They reject most conveniences of modern technology and pharmaceuticals and maintain self-sufficiency. They value rural life, manual labor, humility, and submission to God's will, with view to neither interrupt family time nor replace face-to-face conversations whenever possible. During testimony before the Pennsylvania Senate, expert health advocates shared details on why there have never been any reports published regarding the health of Amish children in general. Steve Kirsch testified, quote, "After decades of studying the Amish, there's no report because the report would be devastating to the narrative," unquote. Open quote, "It would show that CDC has been harming the public for decades and saying nothing and burying all the data," end quote. Leading American cardiologist Dr. Peter McCullough has dozens of peer-reviewed published works related to the rise of chronic conditions among the public. Kirsch and McCullough joined top attorney Tom Renz and medical legal death investigator Graham Hetrick on a panel of experts who testified before Pennsylvania State Senate. The experts all noted that chronic conditions are soaring among American people. However, they concluded that these conditions are non-existent among the unvaxxed Amish community. I implore you, board members, to consider and research the multiple devastating effects of childhood vaccination schedule and work to curb the county's mandatory vaccination requirements for education. Thank you for your time.
I have one more name here, David Dorn. Is David here or
Not able to
online?
make it.
Okay, so that concludes our public speaking. Did everybody get their chance? Thank you for your patience today. Okay. I would now like to take a motion and a second for adjournment. Tarver moves.
Second.
Juby seconds. Can I have roll call?
Keep involved.
All in favor, say aye.
I'll remember that tomorrow.
Yeah. What was that?
All in favor, aye.
All in favor, say aye.
As for any opposed.
And is anybody opposed? Is anybody